You can't tell the difference between Takotsubo syndrome and a heart attack. I've actually had patients, women in particular, one guy that I can think of offhand who came into my practice. I checked their pulses. I double checked their pulses. I listened to their heart, send them into the emergency room, and they were either having or had recently had a heart attack and didn't know it. Not all heart attacks are obvious. I had a guy, saw him today actually, came in a little while back, and we got his EKG, and he'd gone in because he thought he had COVID. Went in and got checked out. Doctor said, "Hey, you're fine. I think you've got a little post-viral illness. This fatigue you're having, just a post-viral problem." Well, they sent him home with his EKG. I said, "So how were all your labs?" He said, "Oh, the doc said they're fine." I said, "Can I see them?" And I looked at his EKG and I said, "What did your doctor tell you about your EKG?" He said, "Nothing." I said, "Did he tell you that you'd had a heart attack?" Because right there at the top of the EKG, it said abnormal EKG. And then it listed several different problems, tachycardia, rapid heartbeat, et cetera, things that are slightly problematic. But right at the end, it said that he had had a heart attack. That's not the term they use, so he didn't recognize it, but it was a septal problem. And it indicated that part of his heart muscle had died. Now, they didn't know when. It could have been what brought him into the hospital. It could have been 10 years earlier. No telling. But he had had a heart attack and obviously didn't know that he'd had a heart attack. So it can be a little tricky here. But when you do an electrocardiogram, it can show abnormalities that with Takotsubo syndrome can look very similar to a heart attack. Now, if they do further testing, they'll be able to tell the difference, certainly. But you would need more imaging to rule out a heart attack.